New York-Presbyterian is a very large academic tertiary center. We have two main campuses on either side of New York City, and we have two Ivy League medical schools that are attached to our institution, the Cornell University and the Columbia University Medical School. The hospital looked to develop an RTLS system, hoping that it would help us locate devices throughout the hospital. We have a very large hospital where many buildings, and we were always struggling looking or locating medical devices when we needed them. We've done time flow studies with our own staff, and what we found is that, probably a technician spends 90% of their time on what we call non-value added time. And the largest percentage of non-value added time in their workflow is actually going and trying to locate devices. Initially, we just tagged 150 devices, and it was very successful. We had over 95% compliance, and we decided at that particular point that maybe we should expand it to other areas of the hospital. So within a matter of a month, we went from about 150 pumps in the system to about 4,000 pumps in the system. One of the added values of connecting the pumps to the AeroScout tags was helping us find the pumps during a recall. The hospital is very used to having recall of equipment, but never such a large-scale recall. And not only did we have it once, we had it 3 times in sort of a short period of time, over 6 months, where initially we had to find 1,700 of 4,100 pumps, and the second recall was we had to find all 4,100 pumps again. And I don't think we could have done it as efficiently with the amount of manpower that we utilized to do this without having a locational device on the pumps. It was a true savings of time and effort for the hospital. And then subsequent to that, we had a third recall where we had to find another 1,500 pumps. So we've really been able to see the value of being able to locate our pumps when needed. Everybody was very happy. I think the first reports that I was able to present to the hospital was a reduction of money spent renting pumps. Once they saw that I was able to prove that about 90 to 95% of our pumps never left the facility, the first thing they did is say, okay, we're not going to rent pumps anymore. Let's see what happens if we stop renting pumps. And the end users didn't complain. And so just the first year, we were able to save 50% of the cost of rentals that we had in the previous year. Right now, the hospital has about 8,200 tags in use. Technicians are able to look at the mobile view, locate where their equipment is, and it saved a tremendous amount of time in doing preventative maintenance. So the real credit of the system has been in the reduction of manpower hours, going over these 7 million square feet and trying to find devices that need maintenance. When it will make a difference for a patient is when we can reduce their length of stay, because we're able to put the right device on a patient sooner and get their therapy finished sooner. And I think that's one of the hopes that we have, that we really will be able to affect a patient's length of stay and the quality of their stay of our institution. So if I'm a predictor of anything in my 30 years in healthcare, I would say that information services and biomed are the future. And I would almost say biomed will be information systems. I think that with the amount of devices and the medical technology that interacts with a patient, we're going to need to develop some sort of system where we put all that information together. And I think that Wi-Fi is probably key to the success of that integration. It's just how it's going to be.